Can you imagine getting sick and the fear stopping there? Not fear of the bill, not fear of where to go, not fear of whether someone will see you on time, just the illness and the confidence that the system will respond. In Nigeria, getting sick often comes with questions. Where do we go? Who do we call? How fast can we be seen? Care becomes a decision tree, sometimes a gamble. And for many families, that uncertainty is the hardest part. People don't delay care because they want to. They delay because they are deciding where failure will hurt less. Over time, a quiet fear has taken root. A fear reinforced by stories many Nigerians recognize of simple illnesses that were misread, delayed, or handled at the wrong level and became tragedies. Not because treatment did not exist, but because care started too late or started in the wrong place. Healthcare is meant to work in levels. Primary care as the first contact. Secondary care for cases that need more attention. Tertiary care for complex and specialized treatment. Most illnesses, the vast majority, should be resolved early, close to home, before they become emergencies. But when primary care is weak, everything moves upward. Routine cases crowd general hospitals. General hospitals push cases to teaching hospitals. Teaching hospitals become overwhelmed. Specialists end up treating basic conditions. Emergencies wait behind non-emergencies. Not because people are careless, not because doctors are unwilling, but because the system skips its first step. So care becomes delayed. Simple conditions worsen. Complications increase. Healthcare workers burn out. Families enter crisis mode. And outcomes depend too often on timing, money, or connections. To be fair, the system is not standing still. Teaching hospitals are expanding. Specialist centers are being built. Facilities are upgraded. These investments matter. But healthcare cannot be built from the top down alone. When investment stops at buildings, without strengthening the system beneath them, everything still flows upward. And when everything flows upward, the top carries too much weight. No system can hold that forever. Healthcare works best when problems are caught early. Around the world, strong primary healthcare systems are linked to better outcomes, lower costs, and healthier populations. Not because they're advanced, but because they're accessible. The solution does not start with miracles. It starts with structure. Primary healthcare centers that are fully staffed, properly equipped, and consistently open. Clear referral pathways, so patients move upward only when necessary. And public awareness, so people know where to go first and who to call when care is needed. Emergency stabilization centers at the local government level, not full hospitals, but enough to stabilize, triage, and transfer quickly. Not to replace hospitals, but to prevent delay from becoming danger. Digital or paper-linked records. Simple systems that ensure continuity of care. Care that flows instead of piling up. This doesn't only help patients. It eases pressure on teaching hospitals. It frees specialists to do specialist work. It lowers long-term healthcare costs. It improves working conditions for health professionals. It builds public trust. And it makes care predictable instead of reactive. Not heroics, not emergency miracles, just systems designed to catch people early before illness becomes an emergency and emergencies become tragedies. Can you imagine?